But wait,
I hope.
they're all abandoning it. And even the ones who like it are saying, well, you know, I always had problems with it. What's going on?
Well, giving the Democrats another shot at health care is like giving an axe murderer another axe. I mean, they've done so much damage already with this bill. We're seeing significant increase in premiums, well above what they would have been had the health care bill not been put in place.
Well, do you worry, Senator, that your party is going to make things worse or maybe provide an opportunity for insurance companies to keep raising premiums because you want to either starve the law or delay some of its implementation? And in that gap, insurance companies can continue hike, 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 hike.
Well, that would be unfortunate if that happened, and I'm not going to say that you wouldn't end up with some gaming of the system that way, but the simple fact is that the plan as structured today isn't going to work except to push us into a situation where the government gets expanded by $2.5 trillion, $2.5 trillion over the next 10 years.
Well, would you repeal it or, as John Boehner has indicated, starve it?
I don't think starving or repeal is probably the best approach here.
What would you do?
You basically go in and you restructure it. What we did in this proposal, which actually made some sense, was that we restructured the Medicare system in a way that saved $500 billion to $1 trillion for Medicare, out of Medicare. But we took all that money and we created a brand new entitlement, which we underfunded. We should take the money that was in the Medicare system, that is being saved in the Medicare system, and use it to shore up the Medicare system, which we know is going insolvent. And then we should readdress this issue of uninsured so that we don't end up with a massive new program which we can't afford, but rather set up a program recognizing that there are different demographic groups in the uninsured, and they can be taken care of in different ways, such as through catastrophic plans, such as through health savings accounts, which get you a much more efficient and effective system. And lastly, and most importantly, we have to change the way the health care is delivered in this country. We have to reward people for doing good quality health care at lower costs and stop rewarding people for just doing repetitious things that get you a lot of money and create a lot of fraud.